Hi, it's Dr. Randy from Calstein Family Chiropractic, and today I'm here with Rachel, who's in for headaches. Doesn't have a headache today, but she gets them quite often. How often do you get them?
3 times a week.
Okay, so migraine headaches?
Yes.
And they're debilitating to the point where you can hardly function, right?
Yes.
Okay. And you kind of get them where? In the back of your neck, radiating up?
Yes.
Okay. You get them in the front?
Sometimes.
Mostly in the back.
In the back of my neck.
Okay, so headaches are something that I think respond really well to chiropractic adjustments, and they're pretty simple to take care of. She's definitely a difficult case where they kind of recur, but at least that she gets temporary relief from what is debilitating migraines in some sense. So first thing we're going to do is have her go face down, and we're going to do some trigger point work on her traps, on her rhomboids, and on her levator scap muscles on both sides to sort of loosen up her upper back. So we're just going to kind of get in here and find knots. And as we find them, she has a lot of hypertonicity, hypertonicity and allodynia, which is muscle spasm and basically paraspinal tissue tightness, kind of right through here. And I'm using the pad on my thumb, so I'm not trying not to dig into that muscle too much where it's uncomfortable, but she should feel a firm pressure, especially where she has knots. Kind of like right in, a real common spot is right on the border of this scapula, right on the shoulder blade. She has them more on her right. Are you right-handed?
Mm-hmm.
Yeah. So she, like her right side is more, is tighter than her left, and there's more restriction. There's more trigger point. And then also what we'll do is kind of, if we can, do a little work on the upper trap muscle on both sides, which these are the muscles that run up into the neck. So they're implicated in a lot of headaches. So we kind of just get in here, and she has a lot of knots in her, the base of her neck and her upper shoulders. Too much pressure?
No.
You don't have to lie. Okay. So I'm trying to be light, but at the same time, give enough pressure that we're creating some change in the muscle tissue. Depending on how bad somebody is, we may do this for a minute, 2 minutes, 5, 10 minutes. As long as it takes to get these knots out where it's going to allow her neck adjustment to hold that much better. So we're going to do an adjustment for the upper thoracic spine. There's a lot of ways we can do this. We're going to try face down first. Take a nice deep breath in for me. Exhale, Rachel. Let your shoulders relax. Good. Good. Another one, deep breath in. Exhale all the way out. Excellent. You can go on your back for me. So her upper thoracic spine moved really well. As far as her adjustment goes there. Let's check her neck out. And again, her migraine headaches, like she said, originate from her suboccipital, her upper neck area, right through here. And she just has a lot of tightness, just like she had in her upper back. So same thing, we're going to hold a little pressure on that muscle, like a little suboccipital release. Just a firm pressure, but for the most part it's a gentle technique. You want the patient to feel comfortable, to not, be scared to get adjusted. Okay, so I've seen Rachel before, so I kind of know where her neck goes out of place, and right through here. It's really all throughout her spine. So we're going to get her neck adjusted. Just relax your shoulder for me. Nice and easy. Good. And we're going to get it this way. Relax your shoulders, nice and easy. Good. So, got a good release on both sides. I want to work on those muscles a little bit more. That allows, the adjustment allows the muscles to reset. Helps break down pain and inflammation. It's going to reduce her headaches, at least for her temporarily, which is, you know, a big deal when you have that bad of a headache. And always when we're done with the neck adjustment, we give a little extra long axis traction to the C-spine, opening up the disc space. And we give a little traction into extension, because we want that good cervical curve. So we kind of hold that in extension and then long axis traction. Good. Come on up, and I'm going to do her shoulders too. Swing your feet over that way. Okay. Again, she had all this tightness in her upper shoulders, so we want these to be back. So a little adjustment helps that muscle kind of know, or a joint know where it's supposed to be. And that didn't move. This one, relax that shoulder. Good. Okay. Thank you very much. See you next time.